So immediate 5 extraction and implant. You are not extracting 6, you are not extracting 4, only 5 goes for extraction. Most of the time I will tell delayed loading or delayed implant, because mental foramen is here. You cannot place a good implant. And the extraction socket, there is no bone. Okay, after 2 months the extraction socket will be covered by bone. At the time you can place the implant easily. But immediately placing the implant is quite challenging, no, in 5. So whenever
we should not.
We will see how it looks.
5.5. Only in full
mouth you can place. 5.5 you cannot, single implant 5.5 you should not use. That is another golden rule. 5.5 don't use it as a single implant.
Okay.
Don't put 5.5 one implant and give one crown. Along with another implant you can give it.
This is particularly in relation to 5.5.
5.5. Anywhere. Single implant you should not use for single tooth. Always it is no.
But நீங்க அந்த parallel socket la நம்ம சொன்ன discuss பண்ணோம்ல நேத்து, that we had this 5.5.
That's why she's in full mouth case we can use.
In full mouth
we should not.
In full mouth or partial, no. For single tooth replacement, no.
Okay.
If Genix is available in your country, sure. What kind of system
we use 3 systems right now. Like one is Vita, one is Biohorizons, and another is Anthos. Stomen.
Single piece any system available there? Or you asked?
No sir, I never tried it. Moreover, like most of the oral hygiene is like really bad actually. Almost like D3 and D4. When 90% of the males are smokers and நிறைய சோடா குடிச்சிட்டே இருப்பாங்க இப்போ.
Okay, okay.
Females க்கு பாத்தீங்கன்னா vitamin D levels அவ்வளவு இதுவா இருக்கும்.
You can speak with Nanda son, no?
Yeah.
You know, they are coming to Dubai, no?
I think
They are
so.
having their center and they are coming as consultant to Dubai.
Yes, sir.
So they know details. The availability of implant may be a difficult.
Maybe irukkalam, but my center like they want to be like only specific.
Okay.
Initially I told them like there is one more system called Bone Easy for recent time.
Yes, Bone Easy, Australia.
Yes sir. So ரொம்ப atrophic ridge அந்த மாதிரி இருந்துச்சுன்னா instead of doing augmentation பதிலா நம்ம plates பண்ணுவோம் இந்த trauma. அது ஆனா flap extensive open பண்ணி plate பண்ண போறோம். So I told them like வேண்டாம். We'll stick only to this system.
Bone Easy quite expensive, but it works good to get. So here there are 2 problems for us. One is the nerve. Okay, one is the nerve, and another one is this tooth itself. Once you remove this tooth, where is the remaining bone? So that is why after extraction of lower 5, standalone 5, we will leave it. After 3 months, the good bone will be here.
But your conventional doesn't have any part, right? We can place conventional here.
And delayed one. Delayed one. Here also you can.
Same that. Basically, we adukku conventional la poturom like
yes.
the principle.
No, basal you can place one compressive implant like this and delayed one. Okay. So this is the root outline. Okay. If at all you want to place a compressive, you will place along this.
Engaging both the cortico.
Yes. No, this bone. Only this bone. Okay. So the implant will be exposed here. There without any bone here. Exposed in the socket. When the bone fills, they will get filled with bone. Delayed loading, you can place either conventional or.
Better implant நம்ம ஒரு
So there is one small trick I will be using in premolar to solve this difficulties. So this is along the long axis of the premolar, right? This is along the long axis of the premolar. Only this segment of bone is there. Beyond this we cannot go. Foramen canal is coming. Buccally no bone. So what I do is, I tilt the implant slightly, mesially. So there is bone here, no? This. If I tilt slightly mesially, I can go into a.
So like as you mentioned yesterday, like either we can tilt mesially or buccolingually, going through this CBCT profile.
Yes.
Apically mesial.
3-4 வந்து
You should not go till the 3-4. You should not tilt so much that it is hitting the 3-4.
This is slight.
Yes. Because the compressive implant tip is only tapered, so it is not a problem. It's small or 5-degree mesial tilt. You can get some good bone. That's it. stay close to the palatal. Why? Because buccally metal
But
foramen.
also we have to do delayed loading.
Delayed loading. Or extract weight, then after that you do the implant and
Immediate loading.
immediate loading. Okay. So here we are planning
maximum waiting period 3 months.
3 months.
For both upper and lower.
Upper and lower. Yes. So along the lingual wall, we will be keeping finger on the lingual side. We will drill along the slight mesial angulation. That's it. 3.75 into 10 or something. 10 or 11.7. Okay. So whenever we are replacing one tooth, single tooth, you have to see how much bone is available between the adjacent tooth also. Because by tilting you can use those two. If you are replacing the 6, this bone is good. You can tilt the implant slightly, distally go into it and bend it. Conventional this is not possible. But single piece you can go wherever you want and bend it. Wherever bone is there, place the implant and bend it. The stability is good. So this small freedom is there.
But the extraction of the nickel and treated tooth is
Yes, we have to be careful. So what are the challenges we may face this? As I told, the extraction itself, if it crown breaks, then it is a big headache. Then we have to remove bone here. Even though it looks like there is no bone here, there will be thin bone will be there. CPCT, no. Now we are planning for 6-7 extraction, 6 proximal decay with root extension. I was wondering why 7 they told extraction. There is a buccal decay there. Okay. So we are extracting 6 and 7. So the patient is so if the patient is going for extraction of 6, we need to place 2 implants. If 7 is also going, we need to place only 1 implant extra.
Oh, okay.
Right?
The most distal should be the least
Yes.
diameter, right?
Yes.
So 6 எடுத்துட்டு mesial and distal implant.
No. First the plan is 6 and 7 extraction. So 3 implants. Now we are deciding the location, right? One is in the mesial root. Okay. Distal root will you place? No, because they are close to each other.
Interdental.
Interdental.
So
Mesial to the second, so
Yeah.
7 or
yes. So out of 3, first finalize the mesial one and distal one. Then you can finalize the last one. So the last implant can be placed along this distal root or between lot of interdental bone is there. Okay, either the distal root or this one. So the middle implant better to place here.
Yeah, that's good.
Okay. So this is a tentative plan. So we will do another planning. What we can do is between here and here there is good bone. So we will slide 5° mesial instead of going along the socket. If you go into the socket, there is empty place. But if you tilt mesially, it will be into the healed area. It is like placing implant, more bone coverage for your implant. And second implant here, and third implant either here or this. Okay. So first we will analyze this area. And one more thing, whenever we are extracting 6 and placing implant, check the interdental bone. The more thin it is, the more complicated for us. Okay. If it is a conical root, then it is a more complicated. If there are 2 separate roots away from each other, no, like this, you can place 1 implant here and 1 implant here. If they are very close to each other, then no. If, see, this is after extraction of molar. This bone will give us anchorage. But if it is very thin, it won't give us anchorage. It will crumble. During extraction itself, it will come out.
Sir, இப்போ 7 எடுக்காம only 6 மட்டும் நம்ம replace பண்ணோம்னா
Yes.
இப்போ
So one implant is slightly mesially tilted, and this implant you can go along with the distal root or slightly because there is a good interdental bone. So how much interdental bone is present between the tooth we have to check so that we can do axial inclination.
X-ray also taken. X-ray.
Get this. We will do the planning here. We will see the anatomy. This is along the, so if you extract and if you place along the socket wall, see after extraction this itself is empty place. You have to depend on this bone for stability. So that is why slightly mesially tilting. Yeah, slight mesially tilting. If you tilt slightly mesially, see you can have a good bone. Of course here it is fully cancellous, only this bone you have to rely. Of course we are placing 3 implants and do welding.
Then how do we do only with OPG?
That's why I just
Yeah, that will come.
No, only in this it's so clear that the bone is so.
So here somewhat it looks okay, but here you can see no dark space, maybe during drilling one.
and IOP is on yeah, just with IOP also.
IOP will give a clear picture of bone quality.
So for single with IOP itself,
That's what I don't know. Welder is important not for experienced people. It is for beginning stage. This kind of even if you put many times I put loose implant, the bone will be very soft, will be shaking, but the adjacent 2 or 3 implants will be good. Once you weld it, it will get integrated. Okay. So as you go distally, you have to go for lingual cortical engagement. So our plan is in the mesial root, slight mesial tilting and 3.75, 10. This is along the lingual aspect. Then the second implant in the interdental area. So the myloid ridge is coming to help us. Okay, distal to 6. This is the myloid ridge, this is thing. You can go along the palatal lingual bone and you can park it here, either perfect or you can, because this bone is quite good, compressive implant we can place. Whenever you are placing implant in the interdental area, make sure it is 3.75 only, don't select wider diameter, because the tip is very small. If you use wider diameter, it will crush, remove the. So 3.75 into 11.5 or 10, whatever it is, you can place. Here you will get good stability. So this implant we may not get good stability, but here we will get good stability.
3.5 to 3.75.
3.75. So this is 10 or 11.5. During drilling we can decide it. So this is along the root of 6, 7, distal root of 6. We have to do lingual cortical engagement because this is fully empty place. We have to get engagement from this bone. This is the savior for us. So how much? Around 900 it shows. That is good. Stay along the lingual wall, engage here and place it. Basal also works. We'll see the length. Officially put on the long. Very traditional. So 3.62 will be over. From gum level I am measuring. So extraction won't be a difficult part. So now we have to think from the point of what kind of challenges we will get. Here the extraction may be difficult, but here extraction will be easy. What kind of challenge we get is this interdental bone may get removed, okay, or buccal bone may get fractured, so we have to avoid it.
In such cases, we can do splitting and we can remove it to save the interdental.
Yes, definitely. Dental bone is very thin here.
If you want to engage that also, we want little பண்ணலாம் அந்த மாதிரி.
Yes. So one of the challenges, less stability here because of the poor quality of the bone. But here we will get good stability. So this one. So that is what full mouth is more easier because you have got lot of options. You can go there. But here you can go only,
சார் டவுட்
அது delay loading பண்றோம்.
போட்டுட்டு அதுக்கப்புறம் நம்ம பண்ணிக்கலாம்.
What was it?
இப்போ நமக்கு அந்த இமீடியட் லோட் பண்ணாம இமீடியட்
Yes, you can go delay loading. Yes.
It is enough replacement of implant is
Yes. Sometimes we tell the situation is not very ideal. After extraction, we will see. If possible, we will place implant. That only delay loading. If not possible, after 3 months, don't rush, pressure yourself to do immediate extraction.
So anyway,